I hope you can
Good
hear me.
evening, Prof. Good evening, Prof.
Yeah, good evening. Okay, we'll start the lecture. Let me apologize for the no show of yesterday. I think you were told. Um, let's see how far we can go today. So today we'll start with the sewage disposal. Yes, last time we introduced the course, we got up to the water supply. Today we'll be talking about sewage disposal. Sewage has other names. Some people call it shit, others call it feces, or even others. Some people also call it excreta. The proper disposal of sewage is very, very important because it has a lot of health benefits, and in fact, so much that the readers of the British Medical Journal rated sewage water and sanitation system as the most important medical milestone above anesthesia, antibiotics, and vaccine because of the significant beneficial effect it had on the health of the British. Unfortunately, those of us in the Niger Delta are still suffering, especially those in the riverine communities of the Niger Delta. Not good enough. We have not made significant progress in that regard. Proper toilets is very, very important. But when it comes to the issue of toilets or feces, a lot of us are not comfortable. We know we do it. We do it frequently. And it is very rare for you to find brand ambassadors for toilets because people don't want to be associated with toilets. Except this my man, Bill Gates, who is who is at the forefront of ensuring that everybody has access to a proper toilet all over the world. If once you have it, a proper toilet will reduce the prevalence of diarrhea diseases. And yes, and if you don't have it, in communities that don't have good toilet system, like the riverine communities of the Niger Delta, the prevalence of diarrhea diseases is usually very, very high. For example, the riverine communities of the Niger Delta have one of the highest period prevalence of diarrhea diseases in the country. You can refer to the National Demographic and Health Survey for confirmation. So because of the importance of toilet, WHO has launched several worldwide efforts to ensure that everybody in the world has access to good toilets. It started with the 1980s, which was declared as the International Drinking Water Supply and Sanitation Decade. And then even in MDGs and SDGs, they also have targets for requiring people to have access to sanitation facilities. Okay, the WHO set that target that everyone should have a toilet within a 50-meter distance of his or her residence, within 50 meters of his or her residence. And when we are talking about toilets, toilets, or at times it's called a sanitation facility, they are supposed to serve certain purposes. For example, they shouldn't contaminate water. They shouldn't contaminate water, etc. So in the Niger Delta, even if you have the toilets they call the jetty type toilet, is not counted because that toilet have actually been found to contaminate the environment. Okay. We have what we call the water excreta related health problems. These are diseases that are associated with toilet facilities, and there are 5 of them. There are 5 of them. The first one is the fecal-oral infections. Fecal-oral infections. And the health sciences, they have a unique way of naming health conditions. Fecal-oral means fecal-oral, feces getting into the mouth. Okay. The second group are the soil-transmitted helminths. The third are the beef and pork tapeworm. The fourth group are the water-based helminths, and then the fifth group are the excreta-related insect vectors. These are the 5 excreta-related diseases. These are the 5 excreta-related diseases that are associated with toilet facilities. The first group are the fecal-oral. Fecal-oral, that is the feces getting into the mouth. Feces getting into the mouth. We know that it is. This is very, very common. In fact, if you have ever had worm infestation, usually those ascaris, roundworm, then you would have eaten feces before. Usually we are not aware that we have eaten feces, but feces can get into our mouth through 5 main methods, what they call the 5 F's of fecal-oral infection. 5 F's of fecal-oral infection. The first one is fluid. Fluid stands for water. Fingers, feces contaminating our fingers, especially after cleaning ourselves, after going to the toilet. We have flies, we have foot. People that where there is open defecation, you can step on feces, and from there you can get into your mouth, and then that's then food. Feces can contaminate food, especially if the food is eaten uncooked, without cooking, just such as fruits and vegetables. In fact, when we were in primary school, they used to tell us that if you don't wash fruits without eating, you will get dysentery. Okay, so these are the 5 fecal-oral infections. 5 ways we can get feces can get into our mouth. Okay, the second group are the soil-transmitted helminths. These are worms that are transmitted that are derived from the feces, but are transmitted through the soil. There are 2 categories. The ascaris. Ascaris is roundworm. Roundworm we get through the mouth. The larva, the fertilized egg getting into our mouth, probably through dust, getting into our mouth, and we get infected. This is very, very common in places where they practice open defecation. And then we have the hookworm. Hookworm are transmitted through penetration. They penetrate through the foot, and it's also common in places where they practice open defecation, including in pit latrine. In fact, if you go to a pit latrine, you can actually be infected with hookworm, because the hookworm larva, they have the ability to climb up from the pit latrine up to the floor, where they will now penetrate through the skin of the foot, thereby infecting the person. Okay, so these are the 4 soil transmitted helminths. The third one are the beef and pork tapeworm. Beef and pork tapeworm. These are worms. Tapeworms are transmitted by eating beef or pork that are infected. Beef and pork that are infected. Beef, like the cattle are infected when they graze on grass that is contaminated with feces. While of course you know that pigs are omnivorous, they can eat anything and they can get infected through that process. Okay, then the other one is the soil water-based helminths. These are worms that we get when we wade through the water. If yesterday, the other day, we were talking about water impounding diseases. So these water impounding diseases are similar to these water-based helminths because they are transmitted in water. Okay, so what happens is these water-based helminths are mostly found in impounded water sources. Impounded water sources, yes, the other day we told you, are water sources that don't flow. And because they don't flow, they are usually very contaminated. Very, very contaminated. And because they are rich in organic matter, the water allows, or yes, the water, that impounded water source, it becomes a favorable breeding ground for aquatic snails, which now transmit schistosomiasis, and then of course cyclops that transmit guinea worm. Okay, the next one is the last one is the excreta-related insect vectors. These are insect vectors that breed in excreta. Especially in pit latrine, soakaway, septic tank. These are the places they breed. And these insect vectors include, of course, we know about housefly, we know cockroaches, but we also know mosquitoes. But there are particular types of mosquitoes, species of mosquito that breed in excreta, and they are usually Culex, or they belong to what they call the Culexian family of mosquitoes. Include the Culex mosquitoes and the Aedes mosquitoes. They breed in excreta. Or other sites with organic waste. Please, we have to note that Anopheles mosquitoes don't breed in excreta. And if you check around, what is common to most teaching hospitals in Nigeria is mosquito infestation, and it is studies have actually shown that these infestations are linked to their poor sewage facilities. And of course, the good thing for patients is that Culex are mostly nuisance. They don't transmit malaria, and that is probably that is the saving grace for most of our patients. Okay. Then we have to remember that there is a group of excreta-related diseases that are fecal-oral. It is actually very, very important to wash one's hands, especially if you want to prevent diarrhea. During an epidemic of diarrhea, it should be hand washing should be promoted. And hand washing is not enough to wash hands. but the hand washing should be done in a proper way, and of course, in a proper way and critical times. There are critical times for hand washing. Critical times for hand washing if you want to prevent diarrhea. And those critical times include after defecation, after cleaning up the baby, before food preparation, before eating, and before feeding children. These are very critical times when you want to prevent diarrhea, when we want to prevent diarrhea. And then you have to wash the proper way. You have to wash the proper way using water and, using soap and running water. Please, it has to be running water. And you have to rub your hand at least 3 times, and then preferably you should dry your hand hygienically by air. Although we have written clean cloths here, it is difficult, especially in a public place. If they put a towel there for you to clean your hands, please run away from those towels. Run away from those towels, because those towels are usually very, very contaminated. Usually very, very contaminated. So you have to wash your hands, preferably with running water. Please don't wash your hands in a bowl as it is traditional. Don't wash your hands in a bowl as it is traditional, because of course the contaminants are still remain in the water, and some of the water will get into your hand, and then can also cause other contamination. And it is also not so advisable. It's also especially not so advisable if other persons are also washing their hands in that bowl. In fact, that reminds me, during my primary school days, we used to have such. And I wonder the number of infection that would have transmitted. Okay, at times it is if you don't have a pipe water supply, it may be difficult for you. It will be difficult for you to have if you don't have a pipe supply. If you don't have a pipe supply, it will be difficult for you to have running water. But this Dr. Jim Wast of the Salvation Army, he was able to invent what he called the piggy tap. Piggy tap is almost like it's a container, it's a jerry can with a rope tied to the mouth, and just as illustrated, and you can actually wash your hands using such, creating running water, and making it easy to wash your hands. So we have introduced this sewage disposal, and we have looked at the excreta-related diseases, and then we have talked about hand washing. I don't know if there are questions or comments before we look at the interventions. Do we have any question, any comments? Any question, any comments?
Hello, good evening, Prof.
Yeah, good evening.
Thank you very much, sir. Please, my question is, the critical times for hand washing that you listed, which is the most critical amongst all of them? Because I remember I think a question like this came out during our entrance exam into the program, and the whole thing was just confusing. So I would like to know which among these moments is the most critical of them all. Thank you, sir.
I really don't know which one is. What I know is that all of them are critical. But usually we will when we set an MCQ, we want to catch you out. Remember, it is all about prevention of diarrhea disease. It's all about prevention of diarrhea disease. So usually we know that after eating, especially if you have eaten a bar, you want to wash your hand. Washing your hand after eating a swallow would not prevent you from having diarrhea. Yes, because what will cause diarrhea are the things that you put into your mouth. Okay, so when we are setting MCQ questions, we'll add after eating. After eating, and a lot of persons will just go, will think it's correct. No, it's not. It's not, because the interest is actually prevention of diarrhea disease. Okay? Okay, I just hope I've answered that. So
Okay,
we
thank you,
can,
sir.
yeah. If there is no other question, let's look at the intervention. Please, the WHO has set that target, has set the target of 50 meters. Everybody should have a toilet facility within 50 meters of their residence. And we also have to recognize the fact that it's a fundamental human need. Fundamental human need. And if it's a fundamental human need, it means that the government should also be interested. The government should also be interested in ensuring that we have a place, a good place where we can shit, and shit in safely, without contaminating the environment. So, if taking this into consideration, how are you going to make sure that everybody in the community where you serve have their own toilet facility? That is the question. That is the question. And to do that, you have to consider three things: the cost of the facility, the technical details, the technical details of the facility, which enables it to stop excreta-related diseases, and then the felt needs of members of the community. These are the three things you have to look at: the costs, the technical details, and then the felt needs. The costs should be affordable. The costs of toilets should be affordable. Affordability is very, very important, because irrespective of one's socioeconomic status, the household should be able to have their own toilet. And we are not talking about short put. We are talking about a good toilet that is able to prevent fecal-oral and other excreta-related diseases. Okay? But the good thing is that every household has that ability. Every household has that ability. Has that ability, as we are going to find out. So the next one is the technical details. And these technical details has to do with the ability of the toilet to prevent fecal-oral infection, excreta-related infections. Just look at this illustration. Have you seen this illustration? This is a public toilet. This is a toilet used in the first century, during the Roman time. The toilet is almost like a communal thing. It's a communal thing, and you look at you can see it has multiple holes, and people can actually shit in group. But you see this small gutter here. This gutter, it contained running water. And they usually have a sponge. Look at what they are holding. This sponge is usually dipped into this drain that contains running water, and used after defecation. They use it to clean, but it is not a single use. It's not single use thing. It is actually reused. So after using, the person will just redip it, put it back, and another person will use it. I know that we will cringe. I will know that even saying it, a lot of us will feel very uncomfortable. But that was the situation. That was what they were doing in the Roman time, but based on their understanding based on their understanding, because they were interested in probably the physical cleanliness. They were interested in the physical cleanliness. But right now, we are not interested. We have found out that physical cleanliness is not enough. And that is the reason why we tell you to wash your hands with soap. And wash your hands is you have to wash, rub two hands. Rub two hands together for at least 3 times. That is what we have said, because we know that if you wash your hands with water, if you smell your hand, it will still smell shit. Meaning that your hand, even though you have washed with water, is not clean enough. Okay, so that is it for the technical details. The toilet should be able to stop fecal-oral, excreta-related diseases, and that will mean that it shouldn't involve the handling of fresh stool. You shouldn't handle fresh stool, because of course fresh stool contains billions of microorganisms. He also says that you shouldn't contaminate water, you shouldn't contaminate soil, you shouldn't, the quantity of water used should be such that members of the community should cope with. We are going to examine this because it's very, very important. Usually at times we give you options. We'll give you options, and the only way to answer it is the quantity of water that is available to people. The no handling of fresh stool, any toilet system that involves the handling of fresh stool is not good enough. And that's why the bucket toilet is not good. And that's why open defecation is not good. I remember growing up, children, when I was growing up, were allowed to poo. We are given the freedom to poo anywhere. Anywhere. And I grew up in a very large extended family, and the children then were allowed. Unfortunately, the poo of children are even more dangerous. They are the most dangerous feces, because children, they have most of the excreta-related infections, like especially worms. Okay, you shouldn't contaminate the soil, like open defecation. If you contaminate the soil, then people will have problems with the soil-transmitted hymen's. Remember, soil-transmitted hymen's, ascaris, and hookworm. Hookworm will just pierce your foot when pierce your foot. Okay, and the water requirement is important. Water requirement is important too, especially with the increasing use of water carriage toilets. The standard toilets, the standard water closet toilet uses about 10 liters of water per flush. 10 liters of water per flush. Okay, per flush. And we all know that a lot of times the flush, that one flush is not enough to dislodge. So you have to use more. So you cannot use 20 liters of water per toilet each time you go to toilet, when you depend on Merua. No, when you buy your water, no. It won't be good. So these traditional water flush toilets are not too good when in communities where they have poor water supply. But we must agree that there are now technological innovations. Technological innovations have now been made. For example, toilets are beginning to have 2 buttons. Toilets are beginning to have 2 buttons: a larger button and a smaller button. A smaller button is when you are used to flush urine, and the larger button is used to flush the feces, because it uses more water. Okay, so we have to take note of these. Shouldn't contaminate groundwater. It shouldn't. Okay, so the next one will be the felt nets. These are these are the needs, what the users want. These are what users want. You want the members of the community to use the toilet. So you have to give them, recommend a toilet that they would like to use, that will meet their needs. And what are the needs? What are the needs? The needs include their preferred method of anal cleaning. Their preferred method of anal cleaning, we have to consider. The posture for defecation, you have to consider. Their need for privacy, you have to consider. Their preferred location, the location of the toilet in relation to their house, you have to consider. Do they like to bathe after using a toilet like Muslims? You have to factor in. Do they use feces for other things? You have to also look at that. These are the felt needs. For anal cleaning, in fact, we can divide Nigerians into two. Nigerians into two. Those that use water to clean, and those that can't use water or don't usually use water. Okay, Muslims and the Jaws, they commonly use water for anal cleaning. They commonly use water for anal cleaning, and therefore water flush toilet water flush toilet is recommended for them. But for the Igbos find it difficult to use water. For anal cleaning. They find it difficult, except they are culturized or Hellenized Igbos. They find it difficult to use water, because if you use water, you must handle the feces, and the average Igbo man will find it difficult to handle, to touch feces, even if it's his or her own feces. Okay, so instead they use tissue paper, newspaper, leaf, anything they can use to clean themselves after defecation, except water, which involves handling the feces. So if you go to a rural Igbo community, and cite a water flush toilet, you run into trouble, because it will get blocked. It's likely to get blocked. It's likely to get blocked, because they will use some of them, because especially if they find it difficult to use water. Find it difficult to buy tissue paper, they will block it. The other one is the posture for anal fortification. There are actually two postures. The traditional, or probably the most natural way is to squat. The most natural way is to squat, and I think it's probably one of the best, especially if you have to dislodge hard feces, if you are constipated, you need to squat. And then, but our traditional toilets require that we sit. Okay, a lot of us can sit on the toilet bowl if it's clean enough. So in public toilets, if the public toilet is not too clean, then they will even spot. And when they spot, of course, it can get broken. It can get broken, leading to injuries. So you have to take that into consideration. So the rule of thumb is that for public toilet, please, it's better to use the spot toilets. There is even a water flush toilet that is a spot toilet. Okay. Privacy. Toilet using the toilet is a private business. So you have to make it obscured so that people can sneak in and use the toilet. Preferred location, Muslims will not like the toilet to be located at the east end of their house, because toilet is dirty, it's unclean, and they don't want when they pray they face the east. So they don't want any pollutants, any polluting facility like toilets in that zone. Okay, traditional use of human excreta, you have to also take that into consideration. For example, the Chinese use human excreta for agricultural purposes and other needs. Okay, so when the Chinese build public toilets, they don't charge money because they're interested in the physics. They're interested in the physics because human physics is a resource. Human physics is a resource. There is something you can make money from human physics. So in Chinese, when they build public toilet, they don't charge money. But we know in Nigeria is the other way around. So which means there are businesses that can be done. Somebody can manage and ensure that one can manage public toilets and charge little money. Okay, so these are the needs, these are the conditions. We are talking about three groups of factors we need to consider: the costs, the technical details, and then the felt needs. Technical details considers features of the toilet that are able to prevent excreta-related diseases, while the felt needs appeal to the special needs of the users, especially when it comes to anal cleaning, posturing, and so forth. Okay, so having looked at that, what are the different toilets we have? We can divide toilet into water flush and prop and drop and store toilets, which have also been called latrine. So we have the water carriage toilets, and then we have the latrines. Latrines are also called the drop and store. Latrines basically involves a hole, digging a pit, and then the toilets, the latrines or the drop and store toilet system, they include the simple pit latrine, the VIP, which stands for ventilated improved pit latrine. We have the borehole latrine and the upper privy. Okay, these are the types of toilets. The simple toilet, the simple pit latrine, is just a hole in the ground, and is covered, to ensure that one can safely deposit the feces. The problem is that they smell. They serve as breeding ground for insect vectors, and they are also liable to collapse. So the simple pit latrine is not too good because of the smell, because of the because of the flies. But all these drawbacks were taken care of in the VIP latrine just by the incorporation of a vent. These vents at the back of the toilet with a fly screen at the top is enough to control both the smell and the problem of flies. Okay, just that, and that is what makes it a VIP latrine. That is what makes it a VIP latrine. Just the incorporation of a vent at the back of the toilet is able to solve the problem of smell, solve the problem of flies, because the smell, instead of staying inside the toilet, will go out of the superstructure of the toilet through the vents. Look at the wind flow, as shown in this wind flow. For the flies, flies are phototropic. They fly towards the light. So flies that enter the pit latrine, pit of the latrine. When it looks up, the main source of light will be the light coming from the vent, the tip of the vent, and they will enter the vent. Unfortunately, they can't go out because of the screen, and therefore they become trapped, stay there, get exhausted, and then drop to the pit and then die. So you can see how just very small thing, incorporation of a vent, is able to solve the problem of flies and then the bad smell. And that's what we have in the VIP latrine. Okay. If you have a latrine, if you have ever used a latrine, the problem is that it gets filled. So if you are in a rural area where you have a lot of land, you don't have any problem. You can simply do a safe shifting cultivation. You move to another point. But what of if you are in an urban center where you have limited land? You can actually use a pit latrine in perpetuity. By, instead of having a single pit, you can have a double pit. Instead of having a single pit, you have a double pit. You use one, and once that one is getting filled, you move to the next one. And if you keep a feces for up to 2 years, it will not, all the pathogens in it will die, and then it will not smell. In fact, when you bring it out, you will think that it's ordinary soil. The only difference is that it will be very dark. It is usually darker, very dark. So you can then scoop it out and then use it as fertilizer. Okay, you can then scoop it out and then use it as fertilizer, emptying it for other uses. Okay, so this double pit latrine means that you can use the pit latrine multiple times. The only thing is that you have to line the pit latrine and do it as if you are doing a septic tank. But instead, a septic tank, so that you can use that particular toilet multiple times. Okay, then the water flush toilets, we said about the pour flush. Pour flush, you use little water to dislodge the feces. But the only problem is that if the distance between the toilet and the septic tank is long, there is a likelihood that the feces will not get to the toilet, will not get to the septic tank after the flush. And if it gets, it means that it will block. And to solve the problem, the bedroom is usually connected to it, so that the bedroom will help in flushing the feces. So that the bedroom will help in flushing the feces. We have said about this, the standard water flush system uses 10 liters of water. Then everything will go into the septic tank soakaway construction, and those septic tank soakaway can be said to be their sewage treatment plant, sewage treatment plant. The septic tank is a part of the construction that is plastered all around, and that is where the feces first flow into. And because it is sealed, anaerobic decomposition of the feces takes place there, and after that the water flows into the soakaway. Soakaway is mostly the liquid part. Soakaway is mostly the liquid. Soakaway is mostly the liquid part, and it is called a soakaway because this water, this liquid, is usually is expected to flow to get absorbed into the soil, This is perfect, or this is good enough. This is good only when you have low groundwater level. Low groundwater level. But if you do it in communities like in the riverine communities of the Niger Delta, where the groundwater is very high, the water from the soil will just enter the septic tank and then fill it up. Okay, so that is it. We have to also talk about the sewerage system in some communities. In developed countries, and of course in estates and in towns like Abuja, individuals don't have their own septic tank, but the toilets are connected and then evacuated into a central sewage treatment plant. Where this is used is called the sewerage system. It's called the sewerage system, and that is what it should be. We shouldn't allow. It is not a good policy or a good method to allow individuals to own their own septic tank because they contaminate the environment. The sewage in a community should be centrally managed, and it should be the responsibility of the government to ensure the central treatment of sewage. I must say that some estates have these sewerage systems. Okay, so, and of course in Abuja they also have it. And I'm also saying that most the GRAs, the old GRAs, the GRAs that were built in the colonial era, they also have their own sewage treatment plants. And the treatment plant basically has two sections. The first section for anaerobic decomposition, and then the second section is for aerobic decomposition, where at times they inject oxygen into it to aid the process of decomposition. Okay, that is that. Okay, so I've gone through sewage disposal. Do we have any question, any comments? Questions, comments? Questions, comments on sewage? Yeah, Barry.
Okay, good evening, Prof.
Good evening.
Thank you for the lecture. Very nice. My question is just one. Now, in a very organized urban center like Abuja, you already said that there is sewerage system where there is interconnected general pipes connecting together. But in a city like Port Harcourt, where we are now, it's not likely to be that way because we are yet to get to that urbanization level. So my question now is, what is the official WHO environmental guidelines for the distance between a sewage, call it a soakaway, and a borehole?
Yeah, I think it is about 30 meters. 30 meters is about 100 feet. So it should be almost like the opposite ends of a plot of land. But the problem, as I always say, is the fact that you can observe that spacing, but what of your neighbor? What of your neighbor? You can go through that length, that you can make all the effort to observe the spacing, only to notice that the separation between your borehole and your neighbor's soakaway is the fence. So, and that's why we are saying, that's why it's been advocated that sewage disposal, especially in a town like Port Harcourt, where the groundwater level can actually be low, we should can actually be high. We should have a sewage system. And as I said, the colonial government, especially in the old GRAs, they have sewage treatment plants. They have sewage treatment plants in all the old GRAs. All the old GRAs in Nigeria, they all have their sewage treatment plants. But the problem is that governments are increasingly abdicating from their responsibilities. So almost everybody is now a local government, providing everything. It used to be called, all these things used to be called municipal services. They are called municipal services. That is water supply, solid waste disposal, and then even the management of sewage. They were called municipal services because they were the responsibilities of the local government. And right now, we wonder what our local governments do. We wonder what they do, because they were supposed to be the ones spearheading all this. Okay, thank you very much. If there is no other question, we move to solid waste. We talked about liquid waste, which is we have called sewage. In this case, we have called sewage. There are also okay. Liquid waste is sewage. Okay, although there are various types of liquid waste. The one called sewage is at times called the gray. Is the gray, and then we have the wastewater that is the black. Okay, so but we are looking at the solid waste, and solid waste, they are not free flowing. Solid waste are unwanted, and they are not free flowing. And solid waste, also called refuse, usually can be put into two categories. We have the garbage and we have the rubbish. Garbage are the products, are organic wastes. They are usually products of food preparation. They decompose very quickly, and because of that, we are usually in a hurry to dispose them. While the rubbish, they decompose very slowly, and we are often not in a hurry. For example, the old televisions, old computer screens, old furniture, disused electronics, we find it difficult to dispose them, but they are waste. We find it difficult, but we have to also understand that they are often, that if we leave them in our houses, we are almost like building palaces for the rats, because if you have a problem of rats in your house, just know that it will be in they have made residents out of disused electronics and so forth. Okay, so we have talked about this garbage, usually product of food preparation, and they decompose very fast. Rubbish, they decompose slowly. And there are problems if we don't manage our solid waste properly. We have problems, and these problems can flow from two aspects: the proliferation of vectors and pests as a result of the solid waste, and then the second aspect is the contamination of the environment from the waste. And there are the common vectors that proliferate in waste in solid waste include rats, cockroaches, houseflies, rats, cockroaches, houseflies, and we know that they are responsible for certain diseases like mosquitoes that breed in solid waste. They include Culex mosquitoes and Aedes. Aedes, they usually breed in water contained in artificial containers, while Culex mosquitoes, they breed in water that is rich in organic waste. And we know what they transmit. Culex mosquitoes, they are usually a biting nuisance, and they transmit filarial worms. And filarial worms have a way of attacking our lymphatic system, causing diseases like elephantiasis, and hydrocele. For Aedes mosquitoes, they transmit yellow fever, they transmit Zika, they transmit dengue. So we have to note that. Then houseflies and cockroaches are called mechanical vectors. They are called mechanical vectors, and mechanical vectors are carriers, basically carriers. They can take the microorganism from, say, the toilet, and then drop it on the food. They take the microorganism from the toilet and then drop it on the food, and that's why they are called mechanical vectors. Rats, they transmit several diseases, including especially Lassa. Rats bite fever. At times rats, some rats have a taste, prefer biting human beings. And the funniest thing is that they will bite you each night, and you will not notice. They have an ingenious way of biting without getting noticed. And unfortunately, that their bite is not just a wound, but it can cause fever called the rat bite fever. Rat bite fever. So when it comes to the contamination of the environment, the refuse can generate fumes. They can cause chemical contamination. For example, batteries can contaminate the water, can contaminate groundwater with lead. Okay, so chemical contamination, it can radiological. Remember cocoa toxic dump, where radiological waste were dumped in cocoa pots. Then it can generate allergens. So if refuse are not carted away, fungi will proliferate, and once they proliferate, they'll produce spores, and these spores are dispersed, and when people that are sensitive to them, those people that are asthmatic are sensitive to them, when they breathe them in, it can trigger off asthmatic attack, and that's why they are called allergens. Okay, so we have talked about the solid waste and what they can cause, the harmful effects of improper solid waste disposal, and we have said that it can lead to the proliferation of vectors and pests. We listed cockroaches, houseflies, mosquitoes, rats. We also talked about the possible contamination. Apart from the bad smell, they can release allergens, which can cause asthmatic attack. It can cause fumes. It can contaminate the environment with chemical. So the next thing will be the interventions. What are the possible interventions for solid waste? What are the possible solid waste interventions, what we can do, what we can use to prevent, to ensure proper solid waste disposal. Usually there are what we call the three. We have mentioned these 3 R strategies. In fact, we live in what is called the circular world. In a circular world, there is no waste. In a circular world, there is no waste. Because what is considered waste can easily be used for other purposes. So right now we live in a circular world, which means that money can actually be made from waste, which means that people can even pay. Waste is something that we can trade. We can actually sell. Remember what this condemned iron. They go about looking for iron and other variables to buy. What we consider waste, they are ready to buy from. They are ready to buy them because they can easily resell them. So when it comes to solid waste disposal, what the strategy that is now used is what they call the 3 R. We mentioned in this slide we said 3 R strategy, but certain persons have actually added extra R's. Some say 5 R strategy, others even say 7 R strategy. But the main R strategies are these 3 strategies: reduce, recycle, and prompt removal. Waste reduction, recycling, and prompt removal. In fact, some persons have added refuse. That is refuse to generate waste. They have also added reuse. Reuse is different from recycle, and we are going to discuss them one after the other. To refuse to generate waste is to ensure. For example, we know that when we go out to buy something, usually whatever you buy, they want to put it in a polythene bag for you. No, you can refuse it. You can refuse it. So the other one is reduce. We have to find ways to reduce our waste generation. We have to find ways to reduce the waste. It can be a decision of the household to reduce the quantity of waste you generate. For example, if you are going to the market, you can go with a bag. And you can go with a bag, and you can reuse plastic bags. I know when at the beginning in the 90s, when they were selling these plastic bags, people were reusing it. People will when they are going to the market, they will go with multiple bags. Which they try to reuse. So it's a way of reducing the waste. And there are also other household methods of reducing waste, like composting, even up to the use of household incinerators, composting. When I was doing my youth service in the north, every household had its own compost pit where they pour in ash, droppings, and everything. And during the farming season, they will just cut them and then pour in their farms. Okay, so composting and other methods. We have to do something to reduce the quantity of waste we generate. The next one is reuse. Reuse is when you are using a product in the form in which it was in its original form. When you are using a product in its original form, and the best example is the plastic bottles or water bottles, the one that are commonly used for water. But you notice that they are also being used for other purposes. They are being used for other purposes. For example, in this in these pictures, you will see that bottles for water bottles have been used for zobo, medicine, traditional medicine, and so forth. So this is what a reuse is, but it's different from recycling. Recycling involves processing the waste to serve as raw material for the production of entirely new products. So reprocessing the waste to serve as raw material for the production of entirely new products. So recycling means, yes. So an example is what is shown on this newspaper cutting, coffin being made from recycled paper. So coffin, the recycled paper, the paper was probably used for writing and other stationary stationary use. But after that, but have been converted into a coffin. So coffin is another use. Okay. Then the other one is a prompt removal. Prompt removal is very, very important, especially for garbage. If you don't remove garbage very promptly, they will attract rats. They will attract rats. So this is very, very important. And in Nigeria, the best is door to door. The best is door to door, and not to have a refuse dump, a public refuse dump. Have a door-to-door collection. Okay. So let's talk about the waste management continuum. Waste management continuum from the point of generation in the household to the point of final disposal. Just let's look at that. So in each household, there should be waste bin at every point of waste generation, at any point where waste is generated in the household, and this includes the toilets. It is very, 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 very necessary to have a waste bin in the toilet, because not everything you can flush. For example, you cannot flush a sanitary pad. You can't flush a sanitary pad. So you have to drop it in the waste bin inside the toilet. And of course, wrappings of soap and the rest, you have to drop them there. Then, of course, obviously in the kitchen. But at the end of the day, before you sleep, everything, especially the garbage in the kitchen, should be emptied into a big container of this mold outside the house. And this big container should be big enough to contain all the refuse generated in the household should be able to contain all the refuse generated in the household until it is evacuated. So if the evacuation is every one week, the refuse container should be big enough to contain all the refuse that are generated throughout the week. Okay, should have throughout the week. Okay, and this household refuse bin should have a cover to prevent access to flies and rats. Okay, so then for the streets should have bins of at least 300 liters 300 liters, and if possible, if it is a bin like this, can easily be used with a compassion vehicle. And in markets you have a bigger refuse bin. In fact, what this one is called a dino bin, like a trailer, because in the markets they generate huge quantity of refuse, and you want a refuse bin that can contain all those. Then the method of collection, as you have said, should be door to door. Not any public dump site. It should be door to door. And if permitting, this vehicle, compassion vehicle, and that with the accompanying waste bin can actually be used. One person, a driver, an assistant, can actually serve a whole neighborhood, But we know that in Nigeria, a lot of the collection is done by cart pushers. But door-to-door collection is the most preferred. And from there is moved to the final disposal site. In Nigeria, we have a refuse dump. And we don't have a sanitary landfill. Sanitary landfill is better because measures are taken to protect the groundwater. Because if you dump refuse, the water from the refuse can seep into groundwater, contaminating it. But it's not so with a sanitary landfill. Sanitary landfill, where efforts are made to protect the groundwater or even the air from getting polluted. And usually landfills incinerators are also incorporated. Incinerators they burn refuse at significantly higher temperature, thereby consuming almost all the refuse, including tins, empty cans, and all those things that were considered incombustible. Please note that fires are not the same. In fact, they are of different temperature. The fire with the least temperature is the yellow fire. The fire, yes, that is yellow in color. And after that, you have the blue fire. Blue fire is hotter than yellow fire, and that is why it appears that cooking gas cooks faster than firewood, because firewood usually produces yellow fire, while cooking gas produces blue fire. In fact, at times the fire can also be white. White fire is even hotter. And therefore can cook faster. So for incinerator, they burn at significantly higher temperature, and therefore they are able to consume everything. Anyway, I don't know the temperature, is hellfire. Is there anybody that can tell us the temperature of hellfire? But I assume that hellfire will even be hotter than white fire. Okay, and therefore should be able to incinerate everything. Okay, so we have gone through solid waste disposal. I don't know if there are questions or comments or contributions. Questions, comments, or contributions. Yeah. Hello, any question?
No, sir.
Okay. Okay. So if there is no question, we will continue. We'll continue, and we'll even be faster, so that. So we are going to look at air pollution. And air pollution, air is, of course, is essential. And in our secondary school, we are told the composition of air. We are told the composition of air, but that is when the air is uncontaminated. Most times, the air around us is different from the secondary school's chemistry air. And that temperature around us is called the ambient air. Ambient air is influenced by a lot of things. Ambient air is influenced by a lot of things. For example, the presence of contaminants or pollutants. If you are in a room, the perfume, function, and a lot of other things, including mess, flat mess, they will all contribute to the air. And if you take an air sample, it will be different from the secondary school air. So the next thing we will talk about is the concept of air pollution. The air pollution is not the presence of a pollutant, but the presence of a pollutant at a level, at a concentration that is capable of causing harm. Presence of a pollutant at a level that is capable of causing harm. Okay? At a level that is capable of causing harm. Okay? So in other words, it's not enough to have say carbon monoxide in the air. To detect carbon monoxide in the air, it becomes worrisome if the level of carbon monoxide is high enough to cause ill health. Okay, so we have to note this when we are defining air pollution. Okay, we basically have two types of air pollution. We have the indoor and the outdoor. The indoor air pollution happens inside the house. Outdoor air pollution happens outside. And they are caused by different factors. But both pollutions have the sources of pollution is important. Like in the outdoor, like artisanal refining is a source. In the indoor, the use of biomass fuel, firewood, kerosene, they are important. Or when people smoke, tobacco, environmental tobacco smoke, they are all important. Okay, but in the indoor environment, it's also the level of ventilation. In the indoor environment, the level of ventilation is also important. In the indoor environment, the level of ventilation is also important. And in the colonial period, they relied mostly on natural ventilation. So during the colonial era, they were interested in the sizes of the windows. They were interested in the sizes of the windows, and at times, so when you send a building plan, when you send a building plan, in the colonial days, they were measuring the sizes of the window, and they were even considering whether windows are located in such a way that allow cross ventilation. Okay, but right now we know that we have other sources of ventilation. For example, we have air conditioners. If you have an air conditioner, you may not need a window. So windows are not just the only way. So right now, the emphasis of windows has been reduced. If there are other sources, if there are other ways, other means of ensuring ventilation, like fans and air conditioners. Okay, but for the outdoor air pollution, for the outdoor air pollution is mostly meteorological factors are very, very important. Meteorological factors are very, very important. And meteorological factors that are most important is what they call of course, the wind flow, the wind speed. In Nigeria, we have two types of wind: the trade wind, we have the trade wind, we have the trade wind. So at times we have a windless situation, like right now in Port Harcourt, there is actually no wind, and so if there's any pollution that takes place now, there is actually no movement. And then temperature inversion. Under normal circumstances, hot air go up and then cool air come down. But there are instances where this doesn't occur, and the polluted hot air remains. The polluted hot air remains. In fact, that is what is said to have happened with Cain's sacrifice in the Bible. Cain's sacrifice, the smoke refused to go up because probably there was temperature inversion. So temperature inversion and wind speeds are factors that determine outdoor air pollution. Factors that determine outdoor air pollution. So what are the, hello Rosemary. Hello Rosemary.
Sir, yes, sir. Good evening, sir. Sir,
Good
please,
evening.
before you just explain the indoor pollution, I was wondering why these days buildings have small windows. Like what you said, the air condition. I want to really know the rationale between the air condition and the pollution that the air condition prevents. Like now, if there is a mess in a room, how does the air condition absorb the pollution of that mess?
No. Air condition has to do with the movement of the air from from the building, from inside the room outside. That is what ventilation does. I'm sure that you'll be wondering, or at times it circulates. At times it circulates before going out now.
Yes,
Eh?
sir.
Uh-huh.
Yes, sir.
So yeah, but it finally goes out. Eh? Eh?
Okay.
There may be some circulation before it goes out, but it finally
Yes.
goes out. Okay.
Okay.
Mm.
Okay, sir.
Okay. Okay. So there are other effects. So when we have pollution, there are effects, some health effects. We'll start with indoor air pollution. If you have air pollution, there are effects. And in places where they use firewood in cooking, it has been observed that women and children are mostly affected. Women and children are mostly affected. Women, because they're the ones that do the cooking, And if you cook with firewood, especially in an indoor environment, the woman can inhale a smoke that is almost equivalent to smoking a pack of cigarettes. Okay, so it is that heavy, is that intense. And then for children they usually meal around. They usually meal around their mothers. And they also get exposed. The only additional problem students have is the fact that they breathe faster. Children breathe faster. And because they breathe faster, they breathe in a lot of the smoke. They breathe in more of the smoke. And they also have more problems because their airways are smaller. Because their airways are smaller, any irritation blocks the airways, leading to pneumonia. Okay, so that is how children are more affected. That's how children are more affected. Then the other effects of exposure to indoor air pollution include pneumonia. Pneumonia in children, bronchitis in adults. Pneumonia in children, bronchitis in adults. Pneumonia in children, we have discussed how it results. The blockage the irritation caused by, say, the smoke, causing the blockage of the airways, and with a resultant super infection resulting in pneumonia. Then for the adults, those inhalation of those smoke can destroy the inner linings of the lungs, resulting in bronchitis. It can also lead to cancer, lung cancer, especially when coal is used, and then it results in a low birth weight. Pregnant women that are exposed can give birth to babies with lower birth weight, with low birth weight. Okay, and then asthma. Smoke can trigger off asthmatic attack. It can also result in tuberculosis. Please note that tuberculosis cannot happen without being infected with the TB bacilli. But there is a difference between TB infection and TB disease. I'm sure you were told somehow. You are in epidemiology. TB infection is the presence of the microorganism, and the test is actually what they call the Mantle test. While TB disease is the manifestation of the problem, usually often associated with cough, night sweats, weight loss. Okay. So for air pollution resulting in TB is basically it affects immunity. It affects immunity, thereby reducing the resistance of the person to the infection. The indoor air pollution can cause nasopharyngeal cancers, especially in woods that contain benzene. It can also result in cataracts. So how do we control indoor air pollution? The best way is to use cleaner fuel. To have better. The other way is to have better cleaner fuel, to have a better stove, and then to improve ventilation. Sorry. Okay. So to improve ventilation. So the best way is to use a cleaner fuel. So the cleanest fuel is electricity, but we know that it can be costly. So the next will be the cooking gas. Then comes kerosene and coal. The worst is cow dung. The worst fuel is cow dung, very, very polluting. So the cleaner the fuel, the better. In fact, that is the reason why we can cook in our kitchen and don't have any problem with pollution if we use cooking gas. Then the other one is better stove. In fact, the worst, if we use this what they call the three stone or the tripod stove. If we cook like this, most of the heat generated doesn't go into the pot, and therefore you cook, and yes, doesn't go into the pot. So even the use of a stove like this is capable, cooks faster, and the faster the cooking, the less time spent in the polluting environment. Okay, then we have to also find a way to increase ventilation. In the colonial times where they were using firewood, they actually have chimneys. all their kitchens had chimneys. All their kitchens had chimneys. So if you must cook inside the house, you have to have chimney, eh? And then possibly you can cook outside the house in a hut like this, where the ventilation is better. And then it's also better to cook at waist level. The more you bend to cook, the more polluted air one breathes. Okay? So for the outdoor air pollution, there are several sources, and a lot of those sources are both natural and man-made. Natural, including harmattan. You know, harmattan is associated with severe outdoor air pollution. Then bush burning, gas flaring, road construction. Even if we don't cut away our refuse, the pollution is not just a bad smell, but also the generation of those allergens, those spores of fungi that can trigger off asthmatic attack. Okay, then the health effects. The health effects are similar to those of indoor, because most of the pollutants are the same. But we have to also say that the outdoor air pollution, they have greater health effects, because the pollutants have the ability to react within themselves to produce even more deadly pollutants, more deadly pollutants, in what is called a photochemical effects. The sun is able to help them react. For example, a suit is basically carbon, but if it goes into the atmosphere, it can absorb an acidic air and becomes more acidic. And if you breathe that, it has more irritating effect than if you breathe ordinary particulate matter. Okay, just anyway, I think since you have the slide, you can actually look at the black suit, the Port Harcourt black suit. So what do we do with outdoor air pollution? We reduce the consumption, we reduce the pollution. And to reduce the pollution, it means that we can stop using or reduce our use of fossil fuel and use greener energy, buy electric cars, use inverters, buy small engine vehicles if we cannot buy electric vehicles. And then things like artisanal refining, we must find a better way of refining so that we don't pollute the environment. Okay, so I for this air pollution, I have gone very fast. I don't know if there are questions or comments again. Questions, comments? Okay, yeah, Barry.
Okay, thank you, Prof, for the air pollution lecture. Just a quick one. Could you please do a little juxtaposition of this air pollution and climate change? Are there some superimposition with this?
Yeah. Just to say that, of course, the air pollution, a lot of climate change is associated with these greenhouse gases. And greenhouse gases, a lot of them are carbon dioxide and methane and so forth. Okay, so they are related. But the only thing is that what is currently causing the climate change were the gases that were emitted about 100 years ago. The carbon dioxide that were emitted 100 years ago. So our own, the one we are emitting at this time, they are waiting for our children The effects will be borne by our children. Eh? So, but we still have our responsibility as good ancestors to do something. Eh? So there is there is a relationship. There's a relationship. It's just that what we are suffering now, we are the mess that was created 100 years ago. Okay. Thank you, Yabare. At least, okay. So I don't know. I think it seems I have to stop here. If we continue like this, it seems I'll just finish this course today. But let's stop here. I think the next will be on Monday. Monday we'll be able to push it forward. And if we go with this rate, we can even as well finish this course next week. And then we know that we have completed the third courses so that we can concentrate on the other aspects. And the other aspects will be led by you, because it will be the remaining aspect will include the seminar presentation and the project. Okay. So Yabare, your hand is up again.
Yes, sir, my hand is up again, sir. Hello, Prof.
Go ahead.
Okay, yeah. I have to raise my hand because you said we are done with the lecture for today. So my question is not for the lecture, it's actually for the general SPH. Yeah. Can I go ahead?
Yeah, go ahead now for the general SPH.
Okay. So last year when you told us about the elective courses, the short courses, you said we are permitted to choose one or more, and one of the courses will be free if it will be paid for. Now, when I was selecting it, when I was registering, I saw there was a column where you had to answer yes or no if you were a student of School of Public Health, put your matric number, your graduate number, and but so I chose just one course, climate change and health. That's the one I preferred, though I'm public health student.
Yeah.
It still showed that I should pay.
Yeah. The problem is we are still struggling to affect that. We are still struggling to affect that. We are still struggling to affect that. Yes, I think probably we will try and work it out. But it's a general problem. It's a general problem.
So does it mean I have to pay, or I don't understand? Is it
I said
courses?
it's a problem. Oh, it's a problem of we are trying to work it out with the IT person how to affect the free this thing. It's not only you. It's a general problem. We'll work it out.
Okay,
Yes.
so when are we supposed to start the elective majorly?
But I don't understand you. I don't understand you. We have told you that you have been told that the elective technically we don't have elective. We have converted them to short courses, and those short courses. The problem now is how the payment is being made. How the payment is being made. How to affect the free, the one free course. How to do that? That is the only problem we are struggling with. But we have started the elective.
Thank you, sir. Thank you, sir.
Hello, Joseph.
Okay, Prof. Good evening, Prof.
Good evening.
Yep, mine is also related to the short course we're asked to do. I've registered and I'm yet to still get the link to join. I actually picked public health laboratory, and up till now, I still don't have the link. I don't know
Okay,
if there is a way.
did you pay directly?
No,
Okay,
but
you paid on the platform.
Yes, it said it was going to send the link to my mail.
Yeah,
I didn't get
the problem is, I don't know, I think it's the IT. We're having problems with the IT, because the complaints have been too much. But I've not had time to probably work it out with them. We will do that. The only thing is, if you send us, if you send me your details, or
yes,
you send it to the rep, we'll be able to at least manually add you to the WhatsApp, so that you can attend those lectures.
Oh, okay, sir. So should I send it to you personally?
Anyway, let Ikenna help me in that regard.
Okay, I'll reach out to him then.
Prof, good evening, sir.
Good evening.
Prof, good evening, sir. Yes, sir. I have been trying to get across to you, but I know you must have been very busy. You know, you told us of the program you wanted to attend yesterday and all the rest. I had wanted this Dr. Prigumo. Sir, I don't know.
Okay.
Can I go ahead, sir? Yes, sir.
You go on now.
Okay, sir. I had wanted to ask. Some of us started this program with a short course and we're certificated. I have gotten my certificates too. Are we going to be part of this short courses again?
If you did a bridging short course, that is different now.
Yes, sir. I did, and I've even gotten the certificate, sir.
So is short course just one?
Sir.
I'm asking now, the short courses are different now.
Okay.
I don't understand this question, no. You did a bridging short course. That is different from the different short courses now.
Okay. Because of that, I have not registered. That's what I'm trying to ask. I hope it's not too late for me to register now.
It's not because of that. It's not because of that. How can you say that when the short courses are on different areas?
Okay, Prof, is it too late for me to register now?
I guess I don't know. It's your personal decision to make.
Okay.
Hello, Clara. Oh,
yes,
okay.
sir.
Yeah.
Good evening, sir.
Good evening.
Sir, please, I just wanted to find out the last project list that was out. Some of our names were not there, and the new one has not been published yet. I don't know if any.
Clara, is because deadlines don't mean anything to you. Deadlines don't mean anything. You are given a deadline to submit your topics, and you chose not to.
No, I actually submitted mine before the deadline.
Don't worry. You know, the thing is that it's not your word against mine, because anytime you fill that form, the time is indicated. The time will be indicated. So we are working on it. And hopefully we said last week. We said this last weekend, but we couldn't finish. But we are working. We are working on it. We are not sleeping. Yes, we are not sleeping on it.
Thank you, sir.
But the problem too is that people will be told to fill. And certain persons can even fill up to 10 times. And we just overwhelm the system. Or if there's anybody that can give us a way of identifying such multiple submissions, we'll very much welcome it. But we are working hard. We are working hard. Because we need to get it done so that we can shadow the go, ensure that you have at least, you are able to know how to write your proposal. Then we can shadow for the proposal defense, which should come up early next month. Yes. Hello, Joseph. Hello, Joseph.
Yeah, good evening, Prof, and Happy New Year.
Yeah.
I would like to know when we are expected to, for those of us that have received our topics, I would like to know when we are supposed to submit our proposal. Because some of us are already on it, so I just want to know when we are expected to submit and
It's
how we
good
are
that
going to submit.
it's good that you have started. You may not, you work with your supervisors, and then usually we want also the supervision team to also have a look at it, so that that's our own, the SPH supervision team, so that it will be consistent. Then you may not need to submit it, but you have to present it. And we are looking at probably next month, February. Why we have not brought out the shadow is because we have not completed the process. We have not approved the project for everyone. So once we are able to do that, probably by this weekend, we'll bring out the list and we'll start the process. Okay. And you have the opportunity to present to people, and then corrections will be made. Okay. Hello, Loretta.
Good evening, Prof. Thank you very much for the opportunity. Then I
Yeah.
just want to ask, how best do we contact our supervisors? Because I've been requesting for their contacts, we've not gotten it
Okay,
from.
apologies. We are also trying to work out the system.
Okay,
Because of
sir.
the number, we have
Okay.
tried differently. But we also encourage you to nominate a supervisor where who you are used to. Do you have such person? Or is it
It's Port
nominated?
Harcourt, and I was giving Dr. Labere, so I don't mind.
Okay, you are
Yes,
giving Dr. Labere, or you feel
yes,
Dr.
sir.
Labere?
I filled it.
Eh?
I filled it, sir. I filled his name.
If you are in Port Harcourt now, come now.
Okay, sir.
Come to the school now and see Dr. Labere. He prefers
Okay,
it.
thank you.
Yes.
Thank you, sir.
Yeah. Okay. So thank you very much. Next week we'll fire on, and let's just see if we can finish. In fact, the way you people are not asking questions, it means that we can just finish everything, and so that we can concentrate on the project. After all, you are probably one of others are through with their third courses. So next week, we'll fire on. We'll fire on and see if we can just finish. We'll just finish and give you any other thing you can go and read up. And so that we can just concentrate on preparing for the project. And the other thing is that we are also trying to make it anyway, should I say complicate the whole thing, in the sense that you will present a seminar, and that seminar will be related to your project, and which means that the literature review the seminar will be based on your literature review. We'll try and do that, because we want a situation where you will be very, very knowledgeable in the area of your research. It's another logistic problem. It requires a lot of effort too, but we just want the best for you, in spite of the effort to make, especially as we have actually agreed that our programs are technically beyond 1 year. So we can stretch it. So the seminar you will do will stretch all through. Would stretch probably through 2 months or 3 months. 2 months, 3 months. And how we are going to plan it is that probably once or twice a week or so, we will shadow students, 2 or 3 or 4 students to make their presentation a day, teach everybody for that day, and we will schedule it across so that we are able to cover everybody within 2 or 3 months. As then we prepare for the final defense, and then that will be the end. That is what we are planning. So most of the teaching will now be done by students, and not will now be done by students. So going forward, once we finish this third course, that's why we have to finish next week. Let's finish this thing next week. You have the lecture slides, so we will go and rush it, finish it next week, so that we will quickly arrange for the proposal presentation. After the proposal presentation, we'll start working after the proposal presentation, we'll start working towards this seminar, and then your project, mock defense, and so forth. So thank you very much. I don't know, so more information we provided. The other thing to remind is that next week we are going to finish this course. We are going to rush through this course so that we can concentrate on our project. Okay? Thank you very much. I hope, is there any other question? Is there any question? These hands are old hands now, so they are not new. Okay.
No problem.
Amara.
Yes, Prof.
Yes.
Good evening, Prof.
Yes.
Prof, if we are to finish this course next week, what about the exam? Thank you, Prof. Because
Anyway,
we have 2 papers from last year pending.
okay.
For
No, anyway, we will work it out. We will work it out so that those other courses are technically not serious distance. They are graduate school courses, so they are not too important. But we have to find a way to give you scores. So we have to find a way to do that. But the main exam will be for this one. But we are going to work with David to have it sorted out. Because we want to finish this program, these third courses, so that we can move into the next phase. Okay. Thank you very much.
Prof, before you drop off, yes, Prof. We did a bridging course at the beginning of this master's. There was a certificate that is supposed to be issued to us. I just heard one of the students saying he has gotten his certificate, because I'm yet to get my own.
Oga Joseph.
Yes, sir.
That is very surprising. I'm sure that I don't know. Probably you didn't fulfill all the conditions. Are you on the? You are supposed to be on the. What is it? On the WhatsApp group?
Yes, I'm on the WhatsApp group.
And you didn't hear anything about the certificate.
Payments.
You didn't hear anything about this thing. Okay, we'll talk about that.
I didn't hear anything about the certificate, sir.
No, you weren't active. You were a good man. Hello, Anne. Hello, Anne.
Yeah, hello, Prof. Good evening.
Yeah.
Okay, so Prof, I'm asking about our grades for the courses that we have already written exam for. Because apart from 2 of the courses that we have written and we have seen the grade, we are yet to see the grade.
Outstanding. We are working. We are working. In fact, that was what I was supposed to do over the holidays, but the search for topics caught me. I was struggling with having them approved, and of course getting ready for the short courses. But we are working. The things that they are very easy because they are just CBT. In fact, they should even be released almost immediately. But you have an idea of your score now after the exam, is it not?
I have an idea, but
okay,
we have not actually seen
Don't worry, the official result will come. Thank you very
Okay.
much, and
All
have
right.
the rest of the evening. Thank you very much.
Thank
So
you,
you see you
Prof. Thank
tomorrow.
you, Prof.
See you on see you next week when we hope to finish
Okay.
this course. Thank you.
Thank you, Prof. Good
Thank you,
night, sir.
Prof.
Thank you,
Good
Prof.
night,
Thank you.
Prof.